May is Maternal Mental Health Awareness Month, an important reminder that for many moms, the toughest part of pregnancy and postpartum isn't always physical. Joining us in the studio is LeJeune Johnson, who is a licensed clinical social worker, and she's here to talk to us about the warning signs to watch for. Thanks so much for joining me.
Of course, I'm so glad that y'all are having me and we can center this very important topic.
Now, why is this topic so important to address? Is this kind of an unspoken issue that you see?
Well, you know, supporting the mental health of our moms is so vital because moms are the gateway to having healthy, thriving families, healthy, thriving communities, and there's not really a pathway to us, you know, being able to thrive successfully without centering the mental health of our moms.
Now, what's the difference between the baby blues and postpartum depression, and how do you tell the difference?
Sure. So when it comes to baby blues, actually about 85% of new moms will be diagnosed, or not diagnosed, but will encounter some baby blues. And baby blues is just due to the normal hormonal shifts that moms encounter shortly after having their baby. And this is a short-term adjustment. That is the main thing. Typically, the baby blues resolves itself within a couple of weeks. Mom returns back to normal. But when mom is encountering the baby blues, of course, it doesn't feel so normal, but she will experience things like pervasive tearfulness, sadness, a little bit of irritability, but again, she will return back to her normal functioning. But when it comes to maternal mental health conditions like anxiety or postpartum depression, those are a little bit more long-lasting, and they can be debilitating for some moms. And so what we see is that moms may lose the ability to function or care for themselves, to care for their baby, and it really does require some intervention to help get mom back on track.
Can these mental health issues start even before you deliver, or is this mainly postpartum?
No, absolutely. Maternal mental health conditions can occur in the pregnancy or in the postpartum period. What we know is that moms typically are vulnerable up to 1 year postpartum.
What's the biggest warning signs that family members, husbands, even partners can notice that, you know, something's off?
Yeah. Well, you know, depending on the maternal mental health condition, the symptoms can vary, but some common warning signs that family members can look out for are things like pervasive sadness, tearfulness, hopelessness, also just overwhelming feelings of anxiety, dread, fear, fear of harming the baby, also fear that I'm not a good mom. So those are some of the main indicators to kind of look out for.
And sometimes this is a taboo topic for a lot of women. How do they approach getting help without feeling too embarrassed?
Well, I'm glad that we're centering this topic and talking about it, because the truth of the matter is about 1 in 5 moms will be diagnosed with a maternal mental health condition either in the pregnancy or in the postpartum period. So that lets us know that it is far more common than not. And so really it's about us creating these pockets, these spaces where we can talk about it, raise awareness so moms can kind of know these are the things to look out for.
Now, one quick question before we wrap up. What is the best way for moms to deal with this, I guess, before delivery and postpartum?
Yeah, absolutely. One of the things that we highly encourage is talking to your provider, you know, letting them know what your concerns are in your pregnancy and in the postpartum period. And I also want to shameless plug the National Maternal Mental Health Hotline. There's a 1-800 number, well, it's not 1-800, it's 1-833 TLC Mama, and it's a 24-hour-a-day, 7-day-a-week national hotline that moms, family members can call if they need to get guidance on next steps.
All right, thank you so much for joining me and telling me all about what moms need to know as they approach this exciting but sometimes a little nerve-wracking part of their lives. Thanks so much for joining me.
Absolutely, thank you for having me.